and he may get risk to any injuries, then he can and claim you like some kind of fine. How do you testify if that person is coming to your company and gets sick or maybe, and you have to check about your documentation. If you have the medical surveillance, let's say a person coming to a pesticide company, when you go to there's a medical evidence, and they check the blood levels, and that will monitor. And after 6 months of period, that person also will be again tested, and you will see the level of change and how we can treat him like quickly, so we can prevent the occupational disease associated with that kind of exposure. So let's dive to the third. Because of the limited resource in tool, much of the exposure assessment are not done, and we need some kind of resource like device, machines that will help us to assess and identify specific measurements like the air quality, noise, heat stress, and this is some of the projects. It is the personal dust exposure on a worker. She's working, but as you see, the cement dust that we use contains a silica dust, which will affect the lung and cause cancer. And long-term of exposure will cause the lung cancer, and we have to monitor that based on the personal exposure. And we need devices to monitor this one. We need heat stress exposure, and we need devices. We need some kind of voltage detectors. We're working on electrical power lines, and hazardous gases and vibrating tools. Welding is the most hazardous. You see on the picture, it doesn't seem there will not be risk, but the welding has high poisonous gases like lead, arsenic, and this will contain a long-term exposure will causes severe lung cancer, maybe skin irritation, it goes along. So we need to monitor based on the tools. And the fourth is the lack of organization, health and safety policy and management. And this is the core for gaps, because if we don't have any health and safety policy, we lose direction. So this policy will show us the direction how to implement and have a better health and safety performance. And lack of policy, the policy will contain the commitment, the responsibilities, the resource allocations, and having the policy is the first thing, and organizing and planning. Risk mitigation are mostly are identified in implementation, but it should not be like that. Risk should be identified from the bottom, from the designing to the implementing. So which gaps should be avoided in implementation of risk identification. Hazard identification should go along from higher to the lower level. And the fifth one is lack of stakeholder engagement in mapping. So for this collaboration of stakeholders, as you have listed here, should come up together and contribute the inputs together, because they have different experience, different knowledge. It should be subverted and addressed or discussed when we are drafting standard. And that, okay, so the other is the weak management and commitment to responsibility. And when you come to this, if you see a good health and safety culture, it means that that company has a good health and safety management or leadership, because it comes along when the higher person implements the health and safety, the lower implement it as well. And it's like lead by example. So there is also a gap in here. And also the lack of mandatory requirement for health and safety training and qualification. And this is a very major gap, because majority of the works are not done by a competent person who get training, who get certification, who are well known of the health and safety, who can even identify hazard and mitigate on the site. So health and safety training should be mandates for any organization. And there's also a lot of health and safety officers in site. And it should be unavoidable because they are the competent expertise who will supervise the team on site. And a lot of certified professional health and safety officer and safety committee is also the gaps. And you can see clearly what we have mentioned or discussed in the pictures. And you clearly see most of the scaffolding are made from wooden. And is it the standard to build scaffolding? Who authorizes it? Who inspects it? And there's many gaps, you see, and material that we used on the structure are not according to the standards, and the design are not tested, or it's not even viewed by engineer or other competent bodies, and lack of inspection also the gaps. You see clearly someone hanging on the wooden pole, he may fail, and there is no personal protective equipment. And these are all the gaps observed. So what can we do? And the first one is strengthening the institutional capacity. As we have mentioned, there is a lack of or insufficient number of labor inspectors and also health and safety officers. And we have to increase the number of inspectors and educate them, certify them, and establish a clear audit and monitoring system for the workplace, and also a strict penalty for non-compliance to improve enforcement. And we have to even stabilize Ethiopia standard for personal protective equipment qualification and hazardous substance handling, and specific task procedures should be aligned. And we have to also standardize a pre-employment health screening in workplace incident reporting should be mandatory. And the second one is improving the health and safety governance and accountability. And we have to integrate and make it mandatory to have occupational health and safety budgets as a mandatory for any projects to be proceed. Without it, we cannot continue forward. It should be mandatory. And implement a national system for tracking workplace incidents in exposure assessment by providing resources, maybe doing researches, and also enhancing stakeholder engagement and commitment is also an additional recommendation. And also improving management accountability. As I mentioned, it's the core, and every company should, the higher level should have a commitment and accountability for performance of health and safety. And mandatory health and safety training and qualification should be done, and it should be integrated in mandatory guidelines. Introducing a certified program for health and safety professionals and suppliers. These suppliers who are the external stakeholders. When they come to your company or ecosystem, they will also add risks. So you have to address them what your policy is, and they have to follow your policy as well, and they should be also addressed. And also promoting sustainable environmental friendly procurement practices. This means that some of the material we use can pollute the environment, can pollute the public health. So the material